Hello again. I know I just made a video a few minutes ago, but I meant to tell you guys in that video to talk with your healthcare provider and at least give them the benefit of the doubt of trusting them that they will give you good advice and that they will be honest with you. Ask them things like, if this was you or your family member or a close friend, what would you tell them? And tell them that you want to talk off the record. They don't have to put this in the chart and that you're not going to hold it against them. You just want to find out what they would honestly do. And trust them that they might be honest with you and they might tell you exactly what they would do. Whether it was, I wouldn't take this medicine. I'm mandated to give it to you, but I wouldn't take it. I would clean up my diet. Things like that. Just trust them, because there are providers out there that care about you. There are providers out there that went into this for the sole reason that they want to help people. And then in primary care, their hands are tied by governing bodies. There are a lack of primary care doctors for that reason now in the U.S. People don't want to be a primary care doctor because you can't do the things for the patient that you really want to do. So just trust them that innately and internally they will be honest with you. I can remember one of the most hurtful things that was said to me one time by someone, and I know they were being, they were on an emotional strain, and their loved one was sick, and unfortunately the loved one wouldn't listen to a lot of the things that was being told to them, and they were listening to a healthcare provider that was kind of stringing them along, and they were really sick. But that person said to me, it's because of people like y'all that patients are dying. It's people like y'all who put people on medications that they don't need, and it's people like y'all that don't educate people. And that hurt me to the core, because I'm very honest with patients. I'm very honest with what they need to do and what I feel will help them. But there are patients out there that don't want to listen. There are patients out there that's not going to listen. And there are patients out there that are afraid to ask because they don't know that they have the liberty to ask. They look at doctors or nurse practitioners or PAs as being people who are elite or powerful or have all this wisdom or, I don't know, have all this money or whatever. But it's not that. That's not the case. Nurse practitioners, PAs, physicians, they're all human beings that should want to help. And even if they don't want to help, they're just a human being. So if it offends them in what you ask, who cares? Ask anyway. It's your life. You need to live it the best way you can.